Hi, this is our group's final presentation for exercise 470, and we chose to talk about migraines. Our group consists of myself, Allison.
I'm Marta.
Mary Ryan.
And Jillian Graham.
So first we're going to talk about the summary of physiology of migraines. There are two different mechanisms of migraines, vascular and neurovascular. The vascular is the old theory of how migraines work. In this theory, migraines occur by the vasodilation of the intracerebral arteries, followed by extracranial vasodilation, leading to the pain associated with a migraine. The new theory of how migraines occur is called the neurovascular mechanism. The pain originates from the trigeminal system. This allows nociceptive signals from the meningeal blood vessels to transmit to higher centers of the central nervous system. Once activated, the trigeminal sensory nerve triggers the release of vasoactive neuropeptides. The release of these neuropeptides triggers vasodilation and neuroplasma extravasation, leading to neurogenic inflammation. This mechanism highlights the importance of the coupling between the neural innervation and the vasculature in these nociceptive mechanisms. A continuation of the physiology of migraines is migraines are the leading cause of disability and suffering worldwide, with a prevalence of 1 in 6 individuals in the United States affected by migraines. Migraines affect an individual's ability to work, enjoy family and social events, and their quality of life. The treatment for migraines can include acute or abortive medications along with preventative medications. However, preventative medications are used only by a small percentage of people with migraines. The classifications of migraines include with or without aura. Migraines with aura are those that have full reversible sensory, visual, and other symptoms related to the central nervous system. Aura can begin before the migraine, which most commonly occurs, or it can occur at the onset of a headache or after the headache has stopped. The symptoms that migraines can cause include pro or post-dromal. These symptoms can vary and include pain, fatigue, blurred vision, hypo or hyperactivity, food cravings, and depression. Like any other condition, migraines do have risk factors. These risk factors can be genetics, gender, and age. Due to genetics, the probability of migraines is 40% in a person with one parent that has migraines and 75% in both parents when both parents experience migraines. For gender, adult women are 3 times more likely than men to have migraines. However, in pre-adolescence, migraines are more common in boys. With age, migraines usually begin in late adulthood or early adolescence, and the prevalence peaks in individuals in their 50s and then decreases as people enter their 60s and 70s. And then migraines are very rare occurrences in people at the age of 80 or older.
Now we're going to transition into the benefits of exercise with people who experience migraines. So those who tend to be more physically active have reported a reduction in the frequency of their migraines and less migraine severity. Although exercise can be a triggering factor for some people, the majority in this population can benefit from exercise. We're going to dive a little more into that a couple of slides later. During a migraine attack, beta endorphin levels are found to be lowered, which results in the severe pain of a migraine. Exercise can increase endogenous opioids such as beta endorphins made by the anterior pituitary gland. This hormone modulates pain signals and results in analgesia. Beta endorphin levels are found to be even lower in people with chronic migraines. In the peripheral nervous system, substance P, which is the transmission of pain signals, is inhibited, so it diminishes the transmission of these pain pathways. In the central nervous system, GABA is inhibited, which allows for the increase of dopamine production, bringing more pleasure to the individual. Exercise increases AEA, which is linked to the feeling of a runner's high, which is a positive feeling of euphoria, sedation, and other feeling that eliminates pain. These levels increase mainly during high-intensity endurance training, not low-intensity training, so not all participants will experience this. Rising AEA levels also release cannabinoids 1 and 2. CB1 helps mediate anxiolysis, but both CB1 and CB2 receptors mediate pain reduction. Brain-derived neurotrophic factor, or BDNF, is a molecule related to the growth, differentiation, and survival of neurons. Therefore, these increasing levels after exercise help with neuron plasticity, prevent neural loss, and positive effects on the cognitive function. Aerobic exercises will also decrease pro-inflammatory markers, which make the migraine and its effect worse, and therefore increase anti-inflammatory markers, which promote healing and reduce all symptoms.
Okay, so moving on to special considerations for migraines. Some aspects of exercise program are unique to this population that can include that it can control symptoms of migraines. And some of these symptoms include nausea, vomiting, sensitivity to light and sound, changes in vision, sensation, and speech. Exercise controls the triggers of migraines as well, but always ask your doctor for help before starting any new exercises. Exercise can also improve sleep consistency and relieve stress. Exercise produces the body's natural painkillers, which are called endorphins. These are a group of hormones that secrete within the brain and nervous system. They also have a number of physiological functions as well. Endorphins also induce a sense of well-being for anyone struggling with migraines or anxiety and depression. A continuation of some special considerations. So, what should this population look out for when starting an exercise program? Beginning a new exercise program, make sure to start slow and increase the intensity as needed. Ease into it and do not push yourself too hard, as this can trigger a migraine. You also need to listen to your body. Know the possible triggers of a migraine: skipping meals, caffeine withdrawals, alcohol intake, changes in humidity, temperature, air pressure, increasing activity, and altering diets can induce a migraine. You should always eat before working out to keep your blood pressure up and to keep you energized throughout physical activity. Individuals who live with chronic migraines might not be ready to increase their exercise intensity. This may be due to exercise being a trigger warning for inducing headache attacks. You can always try to experiment with exercise as well to find out which exercise helps to alleviate migraines better for you.
Now we're just going to dive in a little further deeper into why exercise can be a trigger for some of these individuals. As stated before, exercise is not for everyone, but it does help a majority of this population. Calcitonin gene-related peptide, or CGRP, as you see on the screen, is a neuropeptide found extensively in the central and peripheral nervous system that results in vasodilation and sensory transmission of pain pathways. It is increased in pain conditions and has been shown to be released during migraine attacks and return to normal levels after the use of the migraine abortive medication. During exercise, CGRP levels rise, and it is believed that it may be associated with the increased pain experienced in delayed onset muscle soreness. However, CGRP has not been measured during exercise in people with migraine, so its potential role as a mediator through which strenuous exercise could trigger migraine attacks needs further corroboration. Thus, it is important to understand the right proportion and intensity of exercise to avoid possible negative impacts. There are many reasons that exercise can aggravate migraine headache. For example, a sudden initiation of exercise program without proper planning can cause migraine onset due to an increase in the body's oxygen demand. Similarly, starting exercise with an empty stomach can cause a sharp drop in blood sugar levels, leading to migraine onset. Inadequate intake of fluid before, during, or after exercise can also trigger migraine attack due to dehydration of the body. Since high ambient temperature and low barometric pressure are known triggers of migraine. Exercising in a hot climate or at high altitude may induce migraine headache, which usually lasts for either 5 minutes to 48 hours, so kind of a long time span there. This is called exercise headache or exertional headache. Combining adverse ambient conditions with a new exercise program could compound the risk of exercise related headache.
Okay, so when talking about exercise prescription for this population, as stated before, it's really important to prepare for exercising so not to trigger migraines. Performing regular exercise is known to reduce the frequency of migraines. Some things to do for preparation is to stay hydrated. Dehydration can cause migraines. Making sure a proper amount of food is eaten far enough before the exercise. Light warm up before exercising is also important in order to warm your body up so migraines aren't triggered. Also, speaking with the physician should be done before exercise prescription begins. This chart outlines the fit exercise prescription for migraines, the frequency, intensity, time, and type. So depending on the person, there's different types of exercises that can be done, aerobic or resistance exercises, and also flexibility exercises, which should be done no matter what the exercise is in order to stay limber for exercising.
To conclude, migraines are a prevalent condition here in the United States. Exercise helps to manage the symptoms of a migraine, but also be aware that it is not for everyone and it does have precautions that come with it. So always be talking with your doctor and making sure that you are aware of the conditions and the precautions. Aerobic resistance and flexibility training come along with exercise, and like it was stated before, flexibility training should come with any type of exercise that you are performing. And always consult with your doctor before exercising. This is just to make sure that you are doing the correct exercise for your body and for your body type. Always do a proper warm-up and cool down, stay hydrated, and schedule meals properly. Here are our references.